It was 1969. The London hospital scene proudly welcomed a new program, Clinical Neurological Sciences. Two leading neurologists, Dr. Henry Barnett and Dr. Charles Drake, teamed up to lay the foundation for what would become one of the foremost neuroscience programs in Canada.
5 or 10 years, they were coming not just from the London area, but from the rest of Canada and the United States, and then from around the world. There were people from every continent, right here, right in this, in these operating rooms and in the radiology department. There's no question, as I've gone through this process past 20 years, we still have the best training and education for surgeons, bar none, in the world.
You go upstairs onto the 7th floor and you look at the wall that has photographs of everybody that's ever been a staff person with us. You quickly realize that the history of neurology and neurosurgery, a lot of it has been written here.
Health education, research, innovation, and a clinical team comprised of leading neurological disorder specialists in the country.
One of the great things about being in neurosurgery is that you have such a huge spectrum of disease conditions to treat, not just in the brain, but in the spine, all over the body, anywhere there's a nerve.
CNS specialists treat patients for stroke, brain, and spinal injuries, spinal degeneration, tumors, chronic neurological diseases such as MS and Alzheimer's, movement disorders such as ALS and Parkinson's, and epilepsy. This young woman had a previously undiagnosed disorder, an arterial venous malformation. Surgery gave her her life back.
Because my quality of life is better, and I'm just so thankful every day for everything that I have. And the care here was amazing.
And this man had a brain hemorrhage. Treatment saved his life.
I was amazed at all aspects of the hospital, really, and the quality of care is definitely one aspect that really you rate as second to none.
London Health Sciences Centre is a teaching hospital, and its research arm, Lawson Health Research Institute, as well as connections with the University of Western Ontario and Robarts Research Institutes, create a pool of resources unmatched at other centres.
The first thing that we have that many other programs don't have is an integration between our neurologists and our neurosurgeons, our neuropathologists and our neuroimagers. We are a program which is really unlike many others, and that really is the legacy of Charlie Drake and Henry Barnett.
This unique collaboration among staff, along with generous support from donors, has led to incredible innovations that have immediately improved patient care. The installation of the Zigo in 2010 is a fine example. This unit allows a surgeon to perform a diagnostic procedure during surgery. This immediately informs a surgeon that a surgical procedure has had the desired result, thereby dramatically improving the patient's chances for a fast and uncomplicated recovery. The next planned acquisition is a simulator with a neurovascular intervention module. This will allow state-of-the-art training as well as a validation of training effectiveness.
One way you make a difference is by developing new technologies or new procedures to advance care in surgery. But the bigger one is what you leave behind, the quality of the students that you've trained, the young doctors who've come to learn to be neurosurgeons or neurointerventionalists.
With world-class teaching, groundbreaking research, and cutting-edge neuroscience, Clinical Neurological Sciences stands out as a center of excellence at London Health Sciences Centre. Today, CNS is one of the few programs that has not undergone a major physical renovation since its creation. To modernize its healthcare space and continue to provide state-of-the-art care, much support is needed.
That's where the donor dollars are absolutely critical. When you look on the ward and you ask about recreating the observation unit or our recovery units, it means that we can move to the next level in terms of intensive monitoring and get people out quicker in better shape and not having to spend as much time in the type of monitoring units that we traditionally use. So these things change healthcare.